Hey, Miss Smith, how are you? Good morning. My name's Bryce. I'll be your student nurse today. Can you please tell me your name and date of birth real quick? Patient stated name and date of birth. I'm going to put you in a half hours position so it'll be more comfortable for you. Do you have any allergies I need to be aware of? Nope. Okay. So the doctor has issued an NG tube insertion. So what an NG tube is a nasogastric tube, and it goes through a nostril, down through the pharynx and down to the stomach. The reason why for that is because it gives you the nutrients that you can't get from solid foods at the moment. But I have a few things that'll make the procedure a little bit easier, more cleaner. So this is a cleaning pad. It'll get all the excess. If there's any excess on, it'll, instead of getting it on your clothes, it'll be on the pad. I have you a basin. So if you have any indications of shortness of breath, gasping for air, choking, any indication of cyanosis, or throwing up, I can bring this to you and we can stop the procedure immediately. And we can always just retry whenever you feel ready. And so I also have water. So when I start the insertion of the NG tube, when I hit the pharynx, it will be a level of discomfort or a level of resistance. I'll ask you to put your chin to your chest and drink a few sips of water. And the reason for that is it helps lubricate the tube naturally and makes it go down smoother. Alright? And so what I'm going to do is I'm going to put my gloves on. And we will start the NG tube insertion. Alright, so the first thing I need to do is I need to check to see which nostril is the best to use. So can you breathe for me real quick? 1, 2, 3. Breathe for me, 1, 2, 3. Alright, so we will be using the right nostril today. So now I need to measure it. So the tip of the NG tube to the tip of the nose, to the tip of the earlobe, and down to the xyloid process. Alrighty. So we're going to take that real quick. Alrighty. So what I'm going to ask you to do is put your head back for me. Alrighty, and I'm about to insert it for you. Alrighty. Alright, so we have reached the pharynx. So what I'm going to ask you to do is sip on 3. 1, 2, 3, sip. And put your neck to your chin to your chest for me. 1, 2, 3. 1, 2, 3. 1, 2, 3. Alright. So it is in. And now I will have to tape so it doesn't get there we go. So we can avoid it falling out. That's the reason why we tape it. And I'm also tape it to your gown for the fact that it will be out of your way. It'll be easier to handle for you. So now we're going to take you to radiology, where the radiologist will confirm that the NG tube is in place, and the wire is out, which indicates a positive NG tube insertion. Alright, so the doctor has informed me to take your NG tube out. So what I'm going to do is when I start the process of pulling it out, I want you to hold your breath on 3, and I'll let you know when I'll count down 1, 2, 3, and as soon as 3 comes, I want you to hold your breath. Alrighty? So let me take this off. 1, 2, 3. And the NG tube is out.